Hello, today we will look at schizophrenia and which tests that we have to perform before we start a treatment of schizophrenia. Because as we know, we will use antipsychotics for schizophrenia patients, but we cannot start antipsychotics until we know that we are allowed to start them. And how do we know if we are allowed to start them? We need to do some tests. And which test do we do? First of all, the patient will come in and I will check the weight, the height of the patient. We will measure the circumference, so the waist circumference, and in this way I can know that this patient is overweight or not, because we will calculate some BMI. BMI, as you know, is the kilogram of the patient, so the weight of the patient divided by the meter height that he has times itself, so squared. That means that if you are 170 tall, that means you are 1.7 times 1.7, that will equal a number. And you take your weight, for example, 70 kilogram divided by that, and then you will get a BMI. And please check the charts that you have in BMI, and then you can categorize yourself in normal or underweight or overweight, and which stages of overweight we are talking about. Obese, obesity, and so on. So, in this way, the general rule is usually, it's not for everybody, but usually it is, if you're 70 kilograms, then it means you can be 170 tall. I should formulate it in opposite because you cannot affect your height. So if you are 180 tall, then please be around 80 kilograms. If you're 160 tall, be around 60 kilograms. As you see, so it's I'm simplifying it, but in that sense it's easier. Then you don't have to calculate so much. So strive for being the same kilogram as you are tall. So if you're 165, be around 65 kilo. Okay, that was BMI and waist circumference. And why is this important? Because antipsychotics, as we know, can increase the weight of patients. Not all of them, but some of them. And therefore it's important that we decide if this patient is very fit, it's no problem, then we can give an antipsychotic that is giving this patient a little bit of overweight. So it will increase the weight. But it's not a problem. It will only increase a couple of kilograms. Some patients will increase drastically and increase 10 kilograms. Then we need to talk with the patient that we need to switch this. And some patients will not be affected so much. So it all depends on the patient. So don't be afraid of antipsychotics that increase your weight if you are in the normal range, if you are in the normal level. This was weight. Then we go on and we check the ECG. We put electrodes on the chest and we will check the QT prolongation because we have some graphs of the ECG and we have a Q wave, QRS complex, so a Q wave, and from that point until the end of the T wave, so not the beginning of the T wave, many people make this mistake, it's the Q wave until the end of the T wave, that's the QT interval, and if this is more than 500 milliseconds, then please don't give any antipsychotics. Why? Because it can cause torsade de pointes and it can kill the patient. QT prolongation is very dangerous. You should be around 450 and below. That means if you have a level of 450 and you give the antipsychotics and it drastically increase with, let's say, more than 20-30 milliseconds, then you need to consider in reducing the dose of this antipsychotic because it can cause torsade de pointes, QT prolongation. Good. And what do we measure more? We have lab tests. We will take some blood sample from the patient and we will check the lab. What do we have here? We have complete blood count, meaning all the things that you can see in the blood, for example, hemoglobin, and if the patient has anemia. Why? Because antipsychotics can cause anemia. So when I say that antipsychotics can cause this and can cause that, it does not mean that it will cause that. It's a difference between it can cause and it will cause. So don't be afraid when I say all the symptoms here and all the side effects that it will cause it. For many people it will not cause it. But if you have anemia, a low level of blood cells, if you have any blood disease and you start to give antipsychotics, that's dangerous because then you can cause a more severe level of anemia and that is not good for the patient. So complete blood count, and the same with white blood cells. For example, granulocytes. We know, for example, clozapine. Clozapine is an antipsychotic that can cause agranulocytosis. Very rarely, but it can cause it. That means agranulocytosis. No granulocytes. No, and granulocytes are white blood cells. So we will have no white blood cells. And as we know, white blood cells are the police force of your body, of your immune system. We need white blood cells. So, watch out. Complete blood count, white blood cell count. We will check some fasting glucose levels. Why? Because the weight gain. It can increase the sugar level in your body. Therefore, it can increase the obesity. So therefore, we check the BMI first and we check now the glucose level. Do you have any diabetes mellitus? Because you have diabetes mellitus, and then it can increase glucose and it will be dangerous for the diabetes. I'm not saying that you're not allowed to give antipsychotics for diabetes patients. You are allowed. But you check all these values before you start the treatment, and then you can have a proof that the medication caused a higher level of glucose, because before giving antipsychotics, the glucose level in this diabetic patient was not good, but it was not so severe as it is now after the antipsychotic. The same with lipids, triglycerides, cholesterols. So decreased HDL cholesterol, increased LDL cholesterol, increased triglycerides, all leading to weight gain. It can all lead to this increased cholesterol level. And as we know, cholesterol is not good because it can increase the risk of clogging your arteries, leading to myocardial infarction, stroke, peripheral artery disease, and so on. Next one, what do we need to check? Thyroid hormones. Why? Thyroid hormones, antipsychotics can cause a hypothyroidism, for example. Therefore, check the thyroid hormone. It can also cause an increased prolactin level. So you need to check the prolactin level. Hyperprolactinemia, it's called. Increased prolactin in the blood. Emia in the blood. So please check that. You check the urine of the patient. Why? Because some patients maybe take some substances. Cannabis, cocaine, methamphetamine. These can all cause symptoms, hallucinations, and so on that are similar to symptoms of schizophrenia. So please don't treat people who are taking substances with antipsychotics. Why? Because it will not help. That's not the cause. The cause of the hallucinations are these psychedelic drugs or whatever. So you check the urine if we find any substances. And that is, as I mentioned in another video about DSM-5 criteria. In the criteria of diagnosis schizophrenia, it's important that you rule out any substance abuse before you start any treatment and before you give the patient a diagnosis of schizophrenia, because that is not funny. He's taking cocaine or psychedelic drugs, and now you think that he have schizophrenia. So that is not a good way to do it. Good. And what do we have more? Blood pressure. Why do we need to check blood pressure? Because some antipsychotics can actually cause a reduced amount of blood pressure. Orthostatic hypotension, we call it. And that creates a dizziness. And then, of course, we have to check the patient generally. We check the chart. What kind of diseases do the patient have? Do they have any kind of diseases that are decreasing the central nervous system? Antipsychotics can cause a decreased central nervous system. So no coma, no brain damage, tumors. We need to rule out general stuff due to the medication that can make it more severe. So please check the profile of the antipsychotic medication, check the side effects that it can cause, and then according to that, be careful of what you check, what test you make, in order to rule out these things before you start the treatment. And now we have checked everything. Everything was fine. And you have green light. The liver function was, for example, I forgot to say the liver function, kidney function. You checked it. Why? Because, as we know, it's metabolized in the liver, and it's excreted through the urine. So antipsychotic drugs are metabolized in the liver, excreted through the urine. If you have a bad liver, it means it cannot metabolize it. If you have a bad kidney function, it means it cannot be excreted, which means that it accumulates in your body. The levels will be too high. It will be toxic, we call it. But usually, most antipsychotics do not have to be stopped or can be given even if you have liver disease and kidney disease. Actually, this is the case. But some of them have to be reduced. The dose have to be reduced. So please check that out. Please check each medication that if you're a doctor and you are giving that to the patient, if there is any contraindications against liver disease and kidney disease. So I thank you very much for listening. So please take care and have a nice day.